The purpose of this recording is to understand the components of hearing conservation program record keeping. Discussion topics include requirements and importance of accurate records, characteristics of good records, regulatory record keeping requirements, and types of records. Accurate and complete records are the only evidence that the HCP is working correctly and consistently. Valid records are needed for comparing baseline and annual or periodic audiograms to identify standard threshold shifts or declines in pure tone thresholds. Valid records are also needed for documentation to give the professional supervisor as evidence of regulatory compliance and evaluation of the effectiveness of the hearing conservation program. Regulations require record keeping. For example, when a government official inspects a company, they will need to examine records to see which workers are noise exposed and have a STS, and determine whether audiometric monitoring was completed by qualified professionals using calibrated equipment with low ambient noise levels. The most important features of good records are accuracy, thoroughness, organization, and legibility, because these records are reviewed by company officials, government inspectors, workers, and others in the organization's medical or safety departments. Paper records should be typed or neatly written in pen with no erasers. Electronic records should be easily retrievable. In addition, records need to be consistent with company policies and procedures. For example, some companies ask workers to sign their audiometric records and case history forms to enhance the document's authenticity. OSHA requires that records of noise exposure measurements be retained for at least 2 years and audiometric records retained for the duration of the worker's employment. OSHA also mandates a 30-year retention of records. OSHA states that all records required by the regulation must be given upon request to current workers, former workers, their designated representatives, and OSHA. Audiometric records are medical records that should be treated with integrity and confidentiality. Service providers, such as occupational hearing conservationists, are able to disclose results of audiometric monitoring directly to the employer due to the Health Insurance Portability and Accountability Act of 1996, which permits healthcare providers to release health information to an employer without worker authorization if the worker has requested the service relates to medical surveillance of the workplace or determination of work-related injury or illness, or the employer is complying with OSHA, MSHA, or state law. OSHA requires employers to maintain the worker's most recent noise exposure measurements with the record of their audiometry so that it is readily available to the professional supervisor. Each audiometer's make, model, and serial number should be entered into a worker's audiometric record so those who review the records know which audiometers were used for each worker. Records must also note daily calibration with a list of items checked, such as earphones and cords. OSHA requires employers to keep audiometric records that include the worker's name and job classification, date of testing, the examiner's name, date of the last exhaustive calibration of the odometer, most recent noise exposure assessment, and ambient noise levels in the testing room. Records and notes on referrals made for further testing, audiogram interpretations, notifications, and counseling sessions should also be kept. OSHA does not require audiometric technicians to show evidence of certification. However, the person must have satisfactorily demonstrated competence in administering audiometric examinations. It is also a good idea to have documentation showing the professional supervisor's credentials. A record of the worker's otological history should also be kept, including ear infections, diseases, and any other ear problems, as well as a history of hearing loss, recreational noise exposure, and of course, occupational noise exposure history. It is also useful to add any information about the worker's exposure to chemicals or other potentially ototoxic substances. Records of visual inspections of the ear should also be kept, making sure to note whether an otoscope was used. The presence of any redness or swelling, excessive cerumen, or other abnormalities should be reported. Records should also be kept on workers' hearing protectors, including the type, brand, initial fitting date, and any notes about the worker's acceptance of the device and the ability to insert and use correctly. OSHA has revised its requirements for record keeping regarding hearing loss using Form 300. The new rule requires employers to record a work-related standard threshold shift when current thresholds at 2,000, 3,000, and 4,000 hertz average 25 dB or greater. OSHA defines a work-related hearing loss as one caused or contributed to by an event or exposure in the work environment or a pre-existing hearing loss significantly aggravated by the work environment. If a physician or other licensed healthcare professional determines that the hearing loss is not work-related or has not been significantly aggravated by occupational noise, the employer is not required to record the loss on OSHA Form 300. Professional workers are encouraged to review the guidelines on determining work-relatedness when reviewing potentially recordable cases. In summary, valid records are needed to document, monitor, and identify changes in hearing. Good records are accurate, thorough, organized, and legible. OSHA requires that records of noise exposure measurements be retained and made available upon request. Records should be kept on noise exposure measurements, audiometric testing, professional competencies, patient history, and hearing protector information. If a physician or other licensed healthcare professional determines that the hearing loss is not work-related or has not been significantly aggravated by occupational noise, the employer is not required to record the loss on OSHA Form 300. Later,